So I know there's a lot on this slide, but I'm going to break it down into simple ways. First, you're probably wondering, what the heck are bioaerosols and why should I care about them? Well, bioaerosols are airborne microorganisms that come from living things like bacteria and fungi and are produced by living things like plants and pollen. So little is known about bioaerosols, but what we do know is that they have the potential to cause respiratory illnesses, things like asthma, bronchitis, and pneumonia. And what we don't know is what kind of bioaerosols do we have here in Las Vegas? What kind of airborne bacterial, what kind of airborne fungal, pollen, and mold do we have here? How are we rated here in Las Vegas? So my overall objective of my project is to compare all of these measurements over a 1-year span here in the Las Vegas Valley. Well, how am I going to do this? First, we have an established program with the Clark County School District and UNLV that's called the Pollen and Mold Monitoring Program. To have this program, we have to have Nationally Allergy Bureau certified counters, and I'm one of those counters that counts mold and pollen levels here for the city. So with this program, we are the only metropolitan city in the United States that has more than 2 samplers set up in the city. So that gives us an advantage because we are able to see these different microenvironments, to see what parts of the city are better than others. And with these collection samples, we take these from the 5 sites and analyze them through microscopy methods for pollen and mold concentrations. Through another program, we're going to get air filter samples and take those and analyze those for DNA concentrations of bacterial and fungal. This is a brand new procedure which has never been done before. So we'll be able to see and give you a number of what is in our air, how much fungal, how much bacterial is in our air. Taking these measurements, we'll also be able to compare them to particulate matters, which is a known criteria air pollutant. We know that this already causes respiratory illnesses, so we want to compare it with that. What is the significance behind this? Why should you even care about bioaerosols? Well, first, having these measurements, we'll be able to do a mapping system. So do a spatial mapping to look for hot spots. So see if Summerlin has more than North Las Vegas, if UNLV has more than downtown. What is happening in the city? With this, we'll also be able to add new knowledge to the unknown field of bioaerosols. And last, the goal in public health is to help and improve human health. So with this data, we'll be able to have healthcare providers kind of give a tool to them to be able to reduce that burden on our most vulnerable populations of children and elderly, which we know are the highest at risk for asthma attacks and infections of bronchitis and pneumonia. Thank you.